Well, hello there, everyone. Good afternoon. It is now 12 o'clock, so we're going to go ahead and get started. I know we still have a number of attendees still signing on, but want to be mindful of everyone's time. I am Helen Hockey, Executive Director for the Pennsylvania Coalition for Oral Health, and we are so glad that you are all here with us today. We offer these brief updates on the coalition work that we do twice a year, and we want to make sure that everyone who has an interest in oral health is aware of the work that we're doing and places where you can help us. So as always, this meeting will be recorded and shared on our YouTube channel, so you can share the link with others after today. Just a little bit of housekeeping as we get started. All lines in webinar format have been muted by us. We'll keep the background noise to a minimum. You may type any questions that you have into the Q&A box, and we'll try to grab them as they come in, but if not, we will have a little bit of time at the end to answer some questions. And for anyone who may be joining by phone and who might be unable to see the slides right now, we do encourage you to go back and review the video at a later time. We'll send the link out for the presentation directly to everyone who's registered for this event, and you will get all the slides as a PDF because many of our slides have clickable links in them so that you can go and check out the resources we're sharing. So we'll have all of that available to you after the conclusion of the webinar. So we're going to start with a few of our background slides. They're probably pretty familiar to a few of you. The four main focus areas of our coalition really fall into workforce policy, water fluoridation, and vulnerable populations. Those are sort of our four buckets that we talk about a lot. And we're going to talk a little bit about the work that we've taken on in 2024. And I'm going to point out, some of these items will be things we've done more internally as, PCOH staff and board members, but almost all of our work is very collaborative. So if you hear something that interests you, and you can just let us know, and we'd love to have your help in, sharing information, our resources, checking in with a staff member, let us know what you're working on, or, join a task force or a work group. So as always, if there's something that interests you, just please ask. Now, when you attend a PCOH event or you reach out to us about something, these are the folks you're going to be talking to. So our individual emails will be linked in the slides, so you can reach out to any of us anytime to ask questions or learn more about something we're working on. I also want to mention that PCOH relies on a number of students each year to help support our work. We're currently working with 4 students at dental schools and schools of public health at Temple, Penn Dental, at University of Pittsburgh. We're just kind of all over the place. So we're very, very excited to work with students, and they really do help us do a lot of the work. So if you know any students looking for internships or school projects, please feel free to connect us with them. So to start us off this afternoon, I'd like to invite our board chair, Dr. Joan Gletch, to say a few words of welcome to everyone. She should be able to unmute and say hello. Dr. Gletch?
Hello, everyone. I'm having some video problems here with our internet. It's not as stable, so I'm sorry I'm not on camera for you. I was trying different ways to do that, unfortunately, and so I don't want to hold everything up. Welcome. We're so happy to share the great news about PCOH with everyone. Helen's going to be going over the wide range of activities that we've been completing. And you can see it really takes a team, a village, to accomplish all of our goals. I've been fortunate to lead this great group of board of directors that you see listed here. Happy, welcome board members who are here with us. And I think the idea of a coalition is truly important because we're not just talking about dentistry here, we're talking about oral health. And the idea is that we work with many of our allies to promote oral health for the citizens of Pennsylvania and beyond. Helen's going to be sharing our activities based on our strategic plan and our 4 main goals. Thank you for coming to this event, and we look forward to continuing to work with everyone. And just as a last aside, I want to recognize the staff, because although you see the board of directors listed and of course the staff with the previous slide, this is where the magic happens and the activities. So thank you to the wonderful staff, Helen who leads them, and all of the staff who work with us.
Thank you, Dr. Gletch. Thank you so much. Not all of our nonprofits around is lucky to have such great leaders on their board. So we're very excited and super pleased. I did want to specifically mention we had 2 very special board members term off of our PCOH board this past December, Dr. Eve Kimball and Deb Polk, and their service was really invaluable to PCOH. So we miss their expertise on the board, but we're still working with them on committees and other initiatives, and so happy that they're still around to help us. And we were very fortunate to bring on 3 new board members this year. They've got a breadth of expertise that's really helping PCOH grow. So we've got Dr. Stephanie Gill, Micah Gursky, and Julie Lentes, who all joined the board in January. So we hope you have the chance to work with them if you haven't already. Some wonderful folks there. So, of course, I always need to recognize how fortunate we are to have the support that we do from so many corporate and community funders. From those who've been following us for a while, you've noticed that we're quickly growing. We're adding staff, we're adding new programs, we're doing more outreach. And this is largely due to this amazing list of funders that you see here. So because we are a registered 501c3 nonprofit, we are accountable to use our funds. Nearly 80% of our funding went directly to programming in 2023. And we do a lot of that, either directly or through our partners and subcontractors. And even though I know I'll mention a lot of our programs use federal grants, we also rely pretty heavily on our corporate and organizational and individual funders to kind of keep us moving in between those larger federal projects. So you can see our full list of funders and donors in our impact report we publish after the first of the year. So it is linked on the slides here. And we'd also encourage everyone to visit our website. So you can click directly on our funders there to learn more about them. So many of these great organizations have been supporting PCOH for many, many, many years. And so on behalf of the board and the staff, we just want to thank you for all the contributions to our work. And we hope that everyone gets to feel like they're a part of our success. So lastly, before we get into the best part, which is our work updates, just want to mention our online calendar on our website. We've got lots of meetings and conferences that are all held around the state, even outside of the state. So if there's something you're looking forward to or you want to learn more about, it's a great place to look. We've got a ton of resources there. And we can follow us on all our social media channels. I did want to add too, we do have one upcoming event that will be happening next week, which is we're hosting the American Institute of Dental Public Health, and they're going to be presenting an online webinar specifically on the oral health of veterans in Pennsylvania. So if you haven't registered yet for that and you'd like to attend, we're going to have the link in the slides, and Amy's going to drop it in the chat for us as well. So that's a very quickly upcoming event we wanted to mention. And then we'll have another one of these updates in December. So you can mark your calendars now for that. So here's a few of the high-level topic areas we're going to delve into today. As you can see, they align quite well with the priorities I mentioned earlier. And of course, today's information is not inclusive of all of our work, but we didn't think anybody wanted to come to a 6-hour webinar on a Friday in June. So we're going to just give you some snapshots. Our PCOH staff does do a lot of work, as Dr. Gletch mentioned, but we really rely on our partners and our volunteers to help propel initiatives forward. So much of the work we're going to be discussing today as accomplishments is because of the members of all these teams. For example, if you visit our webpage and you check out the request materials page, you're going to find a number of documents focused on reducing the amount of sugar-sweetened beverages that kids consume. Our Family Oral Health Collective, which has representatives from Head Start, the American Academy of Pediatrics, the Office of Rural Health, and the Association of Community Health Centers, all contribute to the creation and distribution of materials like that. So we're really appreciative of all the support from these groups that volunteer their time with PCOH. And of course, I have to mention, we work very closely with our state's Department of Health and the Rural Health Program there and their staff. Pretty much all of our projects involve some collaboration with our state dental director and the public health program administrators at DOH. So we work together to use federal funds in a manner that's as effective as possible. So just a shout out to all of the people who help us do all these great things. So I'm going to start with some updates on our community water fluoridation work. There's some background info here that I'm not going to read to you all, but I'm going to share my 2 favorite facts about water fluoridation. Because sometimes we find ourselves defending water fluoridation, and people often ask why there is such a debate about it. First, water fluoridation is safe and effective. It is one of the most heavily researched public health interventions of all time, and no studies have ever shown harm at the levels recommended for adjustment in water. So that's fact 1. Fact 2, water fluoridation is not specifically for the kids and adults who take great care of their teeth and go to the dentist a few times a year. It helps them, of course, but the real impact is seen in the families who don't have all those things. We know that cavities are preventable if you do all the right things, and we know there are other options to prevent decay if you can reach those families with that information. But not everyone has that knowledge or access or capability. So water fluoridation remains the one thing that we can do that reaches everyone just by turning on the tap. So for Pennsylvania, we've got some work to do on this. I've got some numbers here to share, but we always have to give the warning that you're going to hear many different numbers on water fluoridation status in Pennsylvania. We've got nearly 1,900 community water systems in the state, and each are independently run. So some make their own water, some purchase water from one supplier, some purchase from many suppliers, some make some of their own and then purchase some and mix it all together. So accurate numbers can be very hard to come by unless you're personally talking with each of the 1,897 water systems. So what we have here are basically the best numbers we can come up with after more than 6 years of gathering intel. So as you can see, less than half of Pennsylvanians really get the benefits of optimally fluoridated water. And the national healthy people goal for 2030 is actually 77.1%. So with us sitting at just about 47%, we have a lot of work to do in this space. Kind of scary. We have had a few successes this year in the water fluoridation space. And I want to talk a little bit more about each of these as we progress through the slides here. So first, one of the things we're most proud of so far this year is we were able to partner with Penn Dental Medicine last month and hosted a truly amazing event. Philadelphia celebrated 70 years of community water fluoridation. So Penn and PCOH were able to hold an all-day event that included continuing education courses for dental providers that we had from the American Fluoridation Society. We had an awards luncheon where we were joined by the Philadelphia Water Department and the Department of Public Health Commissioner, and then presentations from groups like the Department of Environmental Protection and the State Dental Association and the Water Center. So it was really just a great event. We've got some pictures and more information on our site, but wanted to share that as something we were really, really proud of for this year. We're also continuing our water operator thank you campaign. Many of you have probably heard your water systems talked about when there's a really big problem. So a big leak or a treatment center spill, or there's a boil water advisory. And very few of us actually think about the water systems and their staff on a day-to-day basis. And probably even less of us probably realize the amount of work and effort that goes into delivering clean and safe drinking water right into your house every single day. So we started our thank you campaign last year so that we can support the folks who do this. And there's a saying in the dental public health community that water operators save way more teeth than dentists do. And we don't tell the people at the water systems that quite enough. So if you'd like more info on our campaign, or if you work with a group like college students or Cub Scouts, and you want some information on how you can reach out to your local water system and tell them thank you, you can click the links in the slides when we send them and get a lot more information. We also are continuing to see increases in traffic to our website for our fluoride resources. and our water fluoridation map, which we're going to talk a little bit more about next here. So here's the map. Hopefully some of you are familiar with this and you may have used it. We're now seeing an average of 4 to 6 views of the map every day. So we know it's being used, which is wonderful. And we created this map in 2021 to make sure that all Pennsylvanians could have live, up-to-date info on if their water system was fluoridated or not. And all of the splotches that you see, the colored, the blue, the red, the green, are the service areas of community water systems. So the areas without splotches actually are not served by water systems, and most rely on private wells. So the blue color represents systems who fluoridate, red means they don't, and green means they fluoridate for some. So we call those mixed systems. For example, the green part in the South Central York area is a system that serves, nearly 200,000 people, but they fluoridate the water only for one small town of about 3,000 people. So that's one of those discrepancies that I mentioned earlier that can be really hard to track. We also had 2 pretty big disappointments in the last 6 months or so, as 2 small water systems in the state voted to discontinue their water fluoridation program. We had Brackenridge near Pittsburgh and Mansfield, that's located up in the north central area of the state, that both discontinued their water fluoridation programs. So as many of you know, we've got the state has a federal CDC grant that supports some of this work. And we have recently supported the Department of Health in their grant submission last month that would allow us to keep this work up for another 3 years. So we're hoping that, the CDC will award Pennsylvania with the state oral health grant, and that we'll be able to keep doing this good work to keep water fluoridation. So we also continue to update and maintain the map as changes come in. So if you're reviewing the map yourself and you see any issues, please definitely let us know right away, because oftentimes that's how we find out that something is changing or happening. So another part of the current CDC grant that I just mentioned is awarding water systems who do fluoridate with grants for updating their equipment and helping systems that want to start and need to buy fluoridation equipment. So we were able to award 4 systems this grant cycle, and they're listed here on the screen, which actually brings our total for the last 5 years to over $250,000. $250,000 awarded to nearly 20 systems across the state. So PCOH also worked with the Department of Environmental Protection and the Safe Drinking Water Program to get a CDC continuing education course on water fluoridation approved for 8 contact hours for water operators. And that's a big deal. It's something that we've actually been working on for almost 6 years because this course was offered by CDC. It helps reiterate the importance of water fluoridation for water operators. But as many of you who might be dental professionals and medical professionals know, if you don't offer continuing education credits, sometimes they don't come. So we're very, very excited. That was just approved, and we're now making sure that everyone who's a water operator is very aware of that. So lastly, when we talk about fluoride, we wanted to mention, when systems vote to roll back their fluoridation programs, one of the things that PCOH is often approached with is, what can a community do to share alternative options, right? So now our water's not fluoridated. Now our kids are missing out. Our older adults are missing out. What can we do for our residents? So we've recently put together a special document that was intended just for these situations. So I've got a sneak peek here. It's not officially published yet, so it may look slightly different when we do finalize it. But we wanted to at least offer a little bit more information that maybe communities could use. I will tell you, for a few of the rollbacks that have occurred in the state over the last few years, it's often financial, and it's often the cost of maintaining equipment and purchasing supplies and things that tend to, give people thought to pause and think about it. And so, the communities know that they're going to be doing a disservice. So they want to know, what can we do instead? How can we help? We've seen programs where, like, child care centers have gone out and purchased fluoridated water so that they can offer it on site to the kids that are in their daycares. So things like that are different options that are out there, and we want to make sure people are aware of those things. So another one of our main focus areas in the coalition is Medicaid advocacy. We want to ensure that people who rely on Medicaid for their healthcare coverage have access to services that actually prevent and treat dental disease. So again, I'm not going to read you all the background points here, but I wanted to point out the enrollment change in Medicaid as something that's sort of new for 2024. If you joined us last year, we were sitting at around 3.2 million people enrolled in Medicaid. That includes adults and children. And now we're at 2.47 million, which is a pretty significant decrease, one that we expected to see because of the pandemic unwinding. So, during the pandemic, nobody was taken off with Medicaid, even if they aged out or something changed in their situation. So, we expected some of this. We are hoping, and I know the state is analyzing, where are these folks now going for their insurance? Are they going to the penny marketplace? Are they just staying uninsured? Are some now covered by private insurance or CHIP? So that's something we're watching pretty closely because we're seeing, less and less people enrolled in Medicaid, which could impact how much people are actually seeking treatment. So our work centers, a lot when we talk about Medicaid around restoring the comprehensive adult dental benefit in Medicaid that was cut back in 2011. So we're going to share some updates on that with you guys today. So here's a high-level look at major work we've been doing. Obviously, the bill to restore the adult benefits is House Bill 1417. We're going to talk a little bit about that. We also want to talk a little bit about some additional funding that was given to the Medicaid program over the last 6 months, and then talk lastly about the state's participation in a very special project, how we're trying to help recruit dental providers for the Medicaid program. So this is a high-level view of the major proposed legislation that's active in our state legislature right now, which would be affecting dental public health. And again, not going to read them all, but we have hyperlinked every single bill right there for you. So if you want to go through and read all of the details of the bill, see any major amendments, track them, we've included all those links. You can look at the full language. But I did want to point out that there's quite a wide variety of topics covered here. We've got Medicaid coverage, we've got teledentistry, we've got interstate license portability. There has just really been an amazing increase in the interest in dental topics, oral health topics, dentistry from our state legislature, at least that I've seen. I've been in the role here with PCOH. This is my 8th year, and I've never seen people so interested in dental, which really makes us happy, right? I mean, it's wonderful. And so we're having so many conversations, which is pretty cool. So I also did want to mention, because we get this question a lot, there is a state telehealth bill that has made a lot of progress over the last few months, Senate Bill 739. And, we've heard that, it could pass as soon as the end of the month and get to the governor's desk. So it's a general telehealth bill, but it would include some dental language and information. So it is possible that our teledentistry bill may not pass on its own if the telehealth bill passes, which includes dentistry. So just a little bit, we get a lot of questions on telehealth, so I wanted to just share that. We've got a couple updates to share that are pretty hot off the press, I would say. Our Department of Human Services in Pennsylvania manages our state Medicaid program, and along with their Chief Dental Officer, Dr. Sean Chamloo, they published a new fee schedule just last week that added 3 new dental codes to the Medicaid fee schedule. The DO-190 and DO-191 codes are diagnostic codes that are intended to be used for dental screenings. So when an exam can't be performed, it's especially relevant for things like dental screenings in schools that meet the mandated requirements, or for when like a public health dental hygiene practitioner is assessing a patient as opposed to a dentist. So those are pretty exciting codes that we're happy are now added to the Medicaid fee schedule. And then the D-2991 code was also added, which is intended for some new treatment options that are out there that will help remineralize the teeth and reverse dental disease without a drill. So it's been wonderful to see our state Medicaid program really start to focus on more prevention and help fund the ways that we can support the prevention of disease rather than just the treatment of disease. So also occurring last week, the Medicaid program offered an online webinar on provider enrollment. So to help anyone who needed more technical assistance on becoming a provider. The webinar was recorded and it's going to be available in the coming weeks on the DHS website. So PCOH will share that with you all as soon as it is ready. Our state also submitted a grant proposal to the federal government to investigate schools billing Medicaid for services. So we're hopeful that Pennsylvania will be chosen for that. And we're also hopeful that the state includes dental initiatives if they are. And then the last thing I just wanted to share as a Medicaid update is that Pennsylvania was chosen as one of 6 pilot states for a project that's being run by the American Dental Association. The Pennsylvania Departments of Human Services and Department of Health, along with PCOH, are all working on ideas to increase the number of dental providers that participate with and bill Medicaid. So sort of alongside that project, we've been working with funding from the CareQuest Institute, and we've developed a number of marketing materials that we're currently rolling out. So you can see pictures of different things on the screen there. These are geared towards, providers to talk about becoming Medicaid providers. But there also, we have some documents geared more towards members because we have found that a lot of Medicaid members don't understand their benefits. Some of them don't even realize they have dental benefits. So we wanted to make sure we're providing some resources along those lines. So we can share printed copies of all these materials, with anybody who needs them. So if you work, say, in a federally qualified health center and you want to put a trifold brochure on Medicaid benefits for dental in your waiting room, we can send you copies of those to put out. Or if you're going to a health fair or you're involved with a Mission of Mercy or a remote area medical event, those are great places to share this information with some of the folks that would attend there. So stay tuned. Hopefully, especially along the lines of this ADA pilot, we're going to start to see some changes and updates and improvements coming as we roll through the next few months. And I will grab Deb's question in the Q&A right now. She asks about dental service coverage for those on Medicare. We're continuing to watch some of the bills that are being presented at the federal level, but it's sort of slow moving. So we've been signing on. I feel like we've been signing on to support letters for that for so long. But for, us in Pennsylvania, we sort of have to wait till the federal government makes changes to Medicare. It's not something that we can do at the state level. So we continue to monitor that, support that, and reaching out, for those of you on the call, if you want to reach out to your local U.S. representatives and U.S. senators, those are great folks to talk to about supporting dental and Medicare, which can be really, really helpful. So the very last thing I wanted to touch on, kind of going back to the Medicaid space for a second, is really just a direct ask for all of you. As I mentioned, our House Bill 1417 is a bill that would restore the comprehensive adult dental benefits under PA Medicaid. It did pass successfully with bipartisan support through the House in December. It's now sitting in the Senate. So if the Senate passes it, then it's real. So, we are really hoping, we know that the Senate Democrats have listed this as a priority, and PCOH and a lot of our partners have been meeting with as many Senate Republicans as we can to make sure that we can educate them on the benefits of why this is so important and the importance of this bill in general. So we'd like to say we're almost to the finish line, but there's still a little bit of work to be done. So we're seeking organizations this week and next week to sign on to our support letter. So Amy's got dropping the link in the chat there, but it'll also be on the slides. So if you have an organization that would like to sign on to support this work, you have the ability to do that, and you can be a part of this really cool change that we're hoping will take place very soon. So moving on to workforce. We've got a few summary statements on the slide here, but I'm going to quickly summarize it and say Pennsylvania needs dental providers and staff, period, badly, period. If anyone's looking for proof of this, we published a number of reports all the way back from 2021 till a year ago, with about 400 pages of data and statements and policy recommendations and all kinds of good stuff that really show the need we have and kind of back up that statement. And they're all available on our website. So if there's something you're looking for, please reach out. The one change I did want to point out, though, on this slide is that we did see a little bit of a change in our dental health professional shortage areas. Now, those numbers come out of the Health Resources and Services Administration, or HRSA, and they designate an area as a shortage area if it has, less than one provider per 5,000 people. So we've seen that number drop down to 148 shortage areas right now. But some of that has to do with the way that they analyze the numbers and data. So we expected to kind of see that change a little bit. But even at 148 shortage areas, we still need that means we need 290 dentists in very specific areas of the state just to meet the minimum threshold for dental providers to population. So that's a big deal. Our state only graduates a little over 300 dentists a year, and many of them choose not to practice in Pennsylvania. So we've really got to focus on bringing providers into our state, and that definitely becomes something that has kind of risen to the top of our priorities as well. But today we're going to touch on a couple other things. We're going to talk a little bit about some of the initiatives that we've seen some progress on over the last 6 months. Now, I do want to mention that when we talk about workforce and places that we need change, we're looking at a variety of things. We're not just, it's so interesting to me because when we say workforce to anyone, they say loan repayment and loan repayment and loan repayment. And that's not at all. I mean, that's a very important part of the work that we need to work on around here. But it's such a small part. There's so many other things that we can work on. And so we look at things from, career pathways with middle school and high school students, all the way up to engaging retired dentists who go and move to rural areas to maybe go work for a day or two a week in a safety net clinic. There's a lot of things we can do in workforce to help improve access in our state. So not just loan repayment. So we've got about 30 or so different ideas that we're currently tracking. Some we are implementing right now, some we're tracking other people implementing, but we wanted to share some that may be of greatest interest. So our website, we maintain and update a workforce dashboard. If you're not familiar, that's the little picture in the upper right-hand corner there. It's on our website. We've recently updated. We've got some just general State Board of Dentistry data on there, and then we also have Medicaid data on there for Medicaid providers. So we put some 2022 and 2023 data in there more recently. So if you're looking for county or regional numbers, state numbers, there's a lot of really good information publicly available right on that dashboard. So if you're an organization that's writing grants, and you need to know how many dentists take Medicaid in your county, it should be an easier place for you to find it. So, and as always, it's not a perfect system. Data are never perfect, but we do our best to try to keep it as up to date as we can. As part of our work, through the State's Oral Health Grant, through HRSA, PCOH also maintains a community practice group that meets monthly. So though this group isn't necessarily implementing a lot of programs, I kind of feel like we're just a think tank. We're focused on really tracking the needs in dental workforce and identifying places where efforts can be improved. So something that's come up quite a bit more recently is the need for an increased number of dental assisting training programs offered through vocational high schools. So the map you see on the bottom right is an interesting visualization of the current VOTEC programs that offer dental assisting. And I know you can't really see that very well, but I think you can probably see the yellow circles, and those yellow circles are the current programs that offer dental assisting. So as you can see, it's not spread equally throughout the state, very heavily concentrated in the Southeast regions. And so we'd like to explore how we could balance that out a little bit with some, future grant funded projects in the next couple of years. So And I will grab the question that's in the chat now. The 290 dentists needed throughout the state to satisfy the access requirements. Clarify if you're referring to locations or dental providers. So that's 290 dentists needed in the 148 shortage areas is kind of where that comes from. So, you know, it's 290 providers, but 148 areas that have a shortage. And they also calculate the population. So when we look at that, I believe it's 1.67 million people that live in those 148 shortage areas that need 290 dentists. So it can be a little confusing, but that's really what we're looking at. And a lot of those areas are the more sparsely populated areas, are rural areas, and also low-income cities also tend to have those higher shortage areas. So that's sort of where HRSA tends to focus on. So with that, our next slide here, I wanted to mention a few other things in the workforce space. So the conversation tends to lean towards dental providers and dental staff when we talk about workforce. But PCOH knows that non-dental providers and staff are equally important in improving oral health, especially in our public health spaces. So working with another MPH student late last year, we were able to publish an online course that was actually designed for long-term care facility staff, so that, you know, the folks that are taking care of our older residents are more equipped to understand oral disease and how to prevent oral disease. The course is also approved for dental continuing education credits, and it's available on our website. So you can check it out anytime and share it, you know, if you work with any local groups or long-term care facilities that might want to share it with their staff. We also continue to annually survey our state's community health workers. So we want to track how many of our community health workers are performing oral health education and providing dental referrals. We sit around, you know, from our last few years of surveys, right around 2/3 of our community health workers are regularly talking about dental care and oral health care. So we know it's an item of interest. And we do offer a continuing education course on our website for them. There's a shorter course on there now that's just about an hour long. And working with Kelly Brown at the Office of Rural Health, we've also, and the AHECS, we're also looking at adding a longer, sort of a more initial course that would be about 3 hours. So stay tuned for that. But we really want to make sure our community health workers feel supported in the work they're doing in the community. And then lastly, we assist the state, as I mentioned, with their oral health HRSA grant that is focused on workforce. And we work with Pennsylvania chapter of the American Academy of Pediatrics. One of the initiatives they do, and they're working on right now, is utilizing teledentistry and virtual dental messaging in the medical office. So they've got a number of resources available that are pretty cool for folks that might be more on the medical side, but want to share some dental information, either during waiting room downtime or you know, in the actual room while they're waiting for the physician to come in. So before we move on to our data and surveillance updates, I did want to mention another shared initiative we were pretty excited to be a part of this year. Our State Dental Hygiene Association, PDHA, worked to get a law passed late last year that would allow public health dental hygiene practitioners, which are our direct access dental hygienists in Pennsylvania, to complete the mandated school screenings in districts that don't currently have a school dental hygienist. Act 55 of 2023 went into effect in February of this year. So PCOH collaborated with PDHA, and we published this explanation document of the new law. So for anyone who's worked in this space, it is very tricky. And we hope that this is helpful to those who want to learn more. And we're always available to answer more questions, of course. We're also hoping to use some proposed grant funds in the coming months to get more information about the state's dental health programs in schools. And, you know, with an end goal of really advocating for more districts to have dental hygiene services programs. The data definitely show that if there's an employee of the school district who's a dental hygienist, the kids actually get completed referrals done more often. So we know that would be a great way to connect kids to care across the state. So by now, I hope many of our returning attendees to these calls are super familiar with this document. This is our 2020-2030 Pennsylvania Oral Health Plan, published by the Department of Health. And we use the plan and its surveillance indicators to basically measure progress across the state and to advocate for change. So we're going to just touch on a few of the data points as we start to wind down today. Some of the major accomplishments I want to highlight are going to be around how we have shared the data across the state in a variety of ways. So we're going to touch on a few things. As I mentioned, we've got some measurable indicators in our state oral health plan. As part of the work with the Department of Health, we were able to create a snapshot document, which actually shows our progress towards the goals and, share it with stakeholders. So those little gauges you see on the left, that's a document that actually shows, hey, in the first 3+ years of the plan, we've made a little bit of progress in some areas. And so check it out. It's on our website. The link will be there so you can see where your work might intersect with those priorities. The other thing I wanted to mention today about data and how it can be used for advocating for greater policy change and new programs and initiatives is that we've been kind of advocating for years for oral health to be a part of our state's maternal and child health block grant or Title V funding. Most states recognize oral health as a priority under this grant, and some even pay their dental directors' salaries from these funds. So in Pennsylvania, oral health isn't considered a priority under our Title V block grant. So this spring, the Bureau of Family Health held a series of meetings across the state to gather input on determining the next set of priorities for the next 2025 to 2030 set of goals. And we were able to have dozens of oral health advocates actually attend the meetings in person and online, go to the information gathering sessions, and heard a lot of great feedback about how the Bureau was very receptive to the idea of oral health being a priority, especially for the child population. So we're hopeful in the coming months that we will see oral health actually selected as a priority for Pennsylvania. And I wanted to throw in a couple pictures. I think I told many of you, as I've seen you throughout meetings and things, that we had like 44 conferences on our schedule this summer or this year. And so we've been a little bit of everywhere. Hopefully we've gotten to catch up with many of you. But just a few pictures of some of the presentations we've done where we share data, right? So we take the data we're collecting and we want to share it with everyone in the state. So PCOH staff presented not only in our state this year, but we were also able to share data at the National Oral Health Conference in Missouri and the CDC grantee closeout meeting in Atlanta already this spring. So really, really exciting, and I'm really proud of all of our staff for the amazing job they do in talking about our work. So the last data point I wanted to discuss today is around our state-recognized school sealant programs. So we track the data from these programs in a CDC database, and our state oral health program at the Department of Health has a goal of seeing 5,000 students for sealants from 2020 to 2025. And I'm really happy to say that even with a pandemic, we are on target to hit that. So the numbers you see here are just our approximate amounts for this year. I wanted to give you guys a little sneak peek. We hope to have all these finalized in the next few weeks, but it's looking like, around 2,000 children were screened by our school sealant programs this year, and around 7,000 sealants placed, which is crazy and wonderful and amazing. So if you are part of a federally qualified health center, rural health clinic, a school hygienist or local and municipal health department, please definitely, if you're interested in participating in this school sealant program initiative, let us know, because we're always looking for more programs to be involved. So, and we'll get that. So as we wrap up today, I'm just going to touch on a few other highlights of our work this kind of happened so far this year. Some of these projects don't necessarily fit into our priority buckets very neatly. So that's something that we kind of have to watch there. But some of you have been involved in our tobacco and nicotine cessation programming. We obviously want more dental providers offering that service. So we've got free continuing education, free resources. We encourage people to use the D1320 code to make sure that we're tracking that properly. We also are doing a number of things, you know, in the space for individuals with disabilities. We know that they don't have the same access to dental care, and we want to make sure that we're doing not only some policy work, you know, around increased funding and increased recognition, but also that we're making sure the folks and the caregivers are really aware of the importance of oral health for that population. So we're really excited to join a new advisory group that's being ran through the ARC of Pennsylvania. So Nicole's been on those calls and really starting to make sure we prioritize oral health in that space. We continue to do some work with HPV promotion, vaccine promotion, making sure that we are getting dental providers comfortable with talking about the HPV vaccine, particularly as it relates to oropharyngeal cancer prevention, because that is our wheelhouse and that is where we need to be. So we were able to recently participate in a Penn State ECHO program and share some information on the importance of that with a lot of stakeholders across the state. We recently started working with our certified school nurse group, PASNAP, which is a great collaboration because we realize that school nurses are really trusted people and professionals in communities, and we want them to be able to share oral health information on a variety of things like community water fluoridation, decreasing sugar sweetened beverage use, you know, fluoride varnish, all kinds of great stuff that we know school nurses are in a great place to share with their students. So we're doing a lot more in that space this year. And then we were really fortunate to go out and visit the group at St. Luke's, I guess about a month or so ago, and do a really nice oral health advocacy training with the folks there and share some of the oral health data that we have and some of the work that, you know, we've been doing to hopefully and learn more about what they're doing. They've been doing a number of initiatives in schools and in their communities. And so we wanted to have a little bit of collaboration there, which was a really great event. So the last slide here really, which just gives a little bit of a few more things that are kind of up and coming. Amy was great to put some of our reach pieces in here. So when we look at, you know, as a coalition, we're out there, we're trying to talk to people, we're trying to make new partners. Is it working? Are we talking to the right people? What's happening? And so, you know, we track how many stakeholders we have, how many people are requesting our materials from our website, because we have a ton of free materials available. And so that's really great. Looking at how many people track us on social media, you know, and use those resources. So all those things are things that we track from an evaluation standpoint. We're also really excited. It got to the point, I think, on our website where we had so many resources that it was almost overwhelming. You couldn't find things. So we are excited to announce that we're going to be launching a refreshed website here in the next couple of weeks. And one of the new sections of the website, which I'm really excited about, will actually be on finding dental care. So PCOH will get calls from residents around the state who are actively seeking dental care and they don't know where to turn. And we have a number of partners who do great work in this space. And we wanted to be able to establish something on our website that could kind of help guide people to where they need to go. So we're really, really excited. There's going to be a new page specifically for folks seeking dental care, and that we'll try to keep it updated as much as we possibly can, with some resources and things, not just, you know, in the Medicaid space or the free space or, you know, pop-up space, but a little bit of everything. So stay tuned for that. We've got some pending grants, which hopefully by December we'll be able to share some information on around some new projects we want to do. I know I mentioned the school health one. We're of course continuing our Medicaid advocacy work and looking at some other collaborative partnerships to work on access and workforce as well. And then just giving you guys all, what is that, like a 16-month heads up, our PA State Oral Health Summit will be occurring next November, so November 12th and 13th of 2025 in Harrisburg. So for many of you on the call who have attended past summits, I know that we get some great feedback from that event. We also just published, and I actually didn't even put that link in, but we'll make sure we do before we send it out. We published our summary video from the 2023 summit, and really just had a great time with that and heard some great feedback. So looking forward to seeing as many of you as I can next November at our next summit. So I will go ahead and move over to here. And I know we've had a couple questions come in. If you can type your questions into the Q&A, that would be great. I know, okay, so we do have a question about school nurses doing screenings in the state. And I know that that is something that is sort of on the radar. It would require some law changes. And one of the things, as I mentioned when we were talking about Act 55, is everything around school health and dental school health programs is so tricky because in our state, it is mandated through the Department of Health and the Department of Education. So we tend to get a lot of overlap, or maybe one wants to do something and one doesn't. And so that's always been a little bit tricky. But I do think, you know, Act 55 was the first step in increasing the people who could do the screenings in the schools. So allowing our direct access hygienists to do it. So it certainly could make sense to take a next step to do a little more with our school nurses, and hoping that our new collaboration with the certified school nurses could explore that a little bit more. So I don't know if I'd call it movement, but I would say it's on the radar. So we'll keep looking at that. Let me just check here. Were there any other questions? I want to give everybody a minute or two to type your questions into the Q&A. And I do, as I'm waiting to see if any other questions come in, I want to reiterate that, you know, PCOH and our staff and our board members are all here to talk with all of you. We really, truly cannot tell you everything that's happening in a 1-hour webinar, a 6-hour webinar, you know, a 3-day retreat. But if there are specific things that you're really interested in and focused on, we would love to have, you know, we have one-on-one calls with folks all the time to talk with them about what's happening, you know, just to see what's going on there. So, and I think we did have, Angie, I don't know if you're able to type your question into the Q&A. We can promote you. I know you've got your hand raised. We can promote you to a panelist to ask your question. Amy, if you're able to do that, we can see if Angie can come off of mute. These webinar formats are a little more strict in this space. So, okay, so Angie, you have now been promoted to panelist, so you can unmute and ask your question if you would like.
That was a mistake. Just push button. Sorry. To another room. Sorry.
That's okay. It happens to all of us, and I swear every time Zoom changes their format every day, so we're constantly learning where the buttons are. So, okay, I don't see any other questions coming into the Q&A. So what we will do next, just so everyone knows, we will be sending out the link to the recording of today's webinar. We'll also send out the slides, like I said, that have all those things linked, so that if you want to go through and click on things to learn more, you'll be able to do that. And again, welcome any questions, feedback, comments, email us, talk to us, call us anytime you need to. So with that, we will go ahead and wrap up our webinar for today. Thank you all so much.